Welcome to Goal Setting for Greater Results. My name is Michael Stroik. I work with CECP, and we at CECP believe measuring results is extremely important, and a very important first step of that is setting realistic and measurable goals. And we know that those goals will be measured, and what gets measured gets done. So we're very excited to have Farron Levy here from True Impact, a certified B Corporation, to help lead this discussion with our distinguished panelists here. And True Impact provides web tools and consulting support for measuring the social, financial, and environmental impact that companies are having, and has been working with a number of companies that are included here and around the world. So I'll pass it on to you, Farron, and thank you for being here.
Great, thank you. And thanks everyone for coming. I've been looking forward to this session. We are really focused on this to be a very, not that the other ones aren't practical, but something that you can take home and apply to your own program. So let me tell you a little bit about overall what our plan here. Number one, we're addressing this issue that companies are increasingly paying attention to this issue of accountability. And you're investing a lot, you're doing a lot, and you want to understand what you're getting for it. So we're going to be focusing a bit on talking through the steps involved in realistic goal setting, what makes sense for your company, are they achievable, and so on, and then also the measurement piece, and what constitutes appropriate data to be gathering and what are practical ways to get at that. And we have Marcy Passarella from PepsiCo, Senior Director of Global Citizenship and Sustainability. And we have Brian Grill, who's the Executive Director of the Office of Corporate Philanthropy at Merck and EVP of the Merck Foundation. And so the agenda here is I want to take 5 minutes, like just 3 slides of a few tactics that we use when we do this kind of measurement work that you can just take home and hopefully apply on your own. And then we'll move into a discussion with Brian and Marcy to talk about their experiences with goal setting and measurement as kind of a mini case study, and have an opportunity for questions. But then we'll turn it over to you, and in your individual tables, kind of the second half of this workshop or panel is that you can kind of introduce yourselves to the other people at your table and talk about, from a measurement and goal setting perspective, what's really worked. What if you're going to tell yourself a year or two ago, some insights so you could have done things better, or your kind of key learnings? Share that with your table, and then also maybe some key questions that you'd like to know about measurement and goal setting, and then we'll report out maybe 1 or 2 per table, and hopefully that will give us some good, robust discussion and opportunity to workshop these different things. So let's before I jump into these quick 3 slides, let me give you a little kind of neat information from the CECP survey, which is starting to focus more on outcomes and measurement. We saw a little bit of it yesterday. 76% of respondents were reporting measuring outcomes for at least one of their grants in their portfolio. So it's obviously kind of on the radar now, and companies are starting to do it and pay attention to it. Although I guess about half that provided specific goals for their grants had a range from outputs, how many people are being served, to outcomes. So there's a broad, there's still a lot out there and kind of navigating and what's appropriate and so on. So there's a great interest, but still a great opportunity for people to improve in this area and learn more about this area. So for just further context, for when you get into the table discussions, we wanted to take a little poll, 2 quick poll questions. One's related to motivation, and the other is about the nature of your portfolio. So just by a show of hands, how many people are here to learn about better measurement because their leadership is explicitly asking for it? Okay. And then how many people are here not, their leadership isn't explicitly asking for it, but you think it will help and they will like it when they get it? Okay, that's great. How many people are doing it for these corporate award programs? BJ over there. And then lastly, how many people are doing it as a way to improve their programs? Great. Oh, I love that. Okay. And just two quick kind of questions related to the nature of your portfolios. How many people have a signature program, something that you're really focused on, a particular issue where you're investing dollars and other support in a very concentrated way? Okay. And then how many have focus areas, but they cover a broad range of different things like arts and culture or the environment or education? Okay, so a mix. All right, good. All right, so that's a good, hopefully you know your table mates a little bit better. And let me jump into this. I know people hate slides, but let me run through this very quickly. I wanted to share with you three kind of practical tactics around thinking about measurement and goal setting that I think would be useful for you to consider. I can't even see these things. Okay, so number one is to get really specific. So a lot of times in this space, people will talk in generalities. So so a typical goal might be reducing childhood obesity or improving student performance or achievement. And those are great, and no one's going to argue against those. But when they're that generic, it's kind of, it doesn't give you much to go on. It doesn't give you much insight on what grants to improve or even what to expect when it's done. And a good solution for that, or good tactic, is make sure your goals, we think of them as turning them into objectives, are very specific. And then an objective is what constitutes success in you achieving that goal. So you see here, that means who or what needs to change, by how much, and when. And you see examples here. You go from reducing childhood obesity to reduce statewide obesity among fifth graders by 50% by 2020. Something that clear can really transform your whole process. And that leads into the second tactic, which that allows you to then forecast your impacts up front. And that can be a really powerful thing, because a lot of times there's nothing worse than speaking in generalities, investing a ton of money and a ton of resources, and then after a year or two turning around and saying, gee whiz, what did we get for this? And you can't say anything particularly compelling. So if you start up front by saying, all right, let's get very specific. And when we get specific, is that practical to achieve? And if we do achieve it, is it going to be impressive to whoever we're reporting to leadership, to our colleagues, to external stakeholders? It's a very powerful thing to be asking yourself. You're almost modeling up front. Then as part of that, a natural question, is it measurable? And are you preparing yourself to measure it? Because once it becomes that concrete, the 50% reduction in obesity by 2020, you have to think about, how are we going to know when we get there? And bake it in up front to your relationship, say, with your nonprofits, and kind of make sure that you're gathering the data you'll need to be able to say whether you've succeeded or not, or monitoring whether you've succeeded or not. And a quick note, by far, the least expensive time to do measurement is right at the beginning, when you bake it into everything you're already doing and piggybacking on existing systems. And then the last one is, once you think about these or get very specific with the objectives, then you can start thinking about, okay, is this compelling? If it's not, what can we do to increase the social impact of that? Can we do other strategies to support our nonprofits, or can we bring in some additional expertise or resources from our companies? And then even, let's also think about our business interests. Are there things that we can do to drive engagement or skill development or recruiting or sales or other stakeholder relations? And it really helps you think about the optimal strategy for maximizing your double or triple bottom line. So this leads us into the third kind of tactic. I don't want to spend much time on this. How many people here are familiar with logic models? Okay, so the traditional logic model in the social sector is this. It's a generally useful concept where you're just mapping out input, how much you're investing, outputs, what are kind of the services and goods that you're delivering, and then different stages of outcomes, what are those different results. And that's really useful in helping to think about cause and effect, but one of the big weaknesses is it can get very process-oriented, and then if you use it to drive measurement, you invariably get caught up in the inputs and the outputs, and then the outcomes kind of fall off the radar. This adjustment that we use, and we kind of welcome you to use it too, this strategic logic model has some of the same content, but inverts it a bit. Don't bother taking notes. We have handouts on your table of this, but you start out with the goal, the larger goal, then you have over on the left the objective, so we just talked about getting specific there, then put in your strategy. What are the 1 or 2 sentences about how you're going to achieve that objective, and then you can put in your metrics, inputs, outputs, and outcomes. And that almost guarantees that you're going to have an outcome-oriented performance indicator structure, because when it's missing, it's very obvious. And that goal and objective is what guides you to what you should be focusing on. That's it. Those are my slides. So let's go on. So let's get on to the more interesting stuff. It's not that. Okay. Let's get on to the panel. Why don't we start with, well, let's do Marcy. Marcy, if you could start with kind of a general introduction to PepsiCo, also talk a little bit about performance with purpose, which is, well, Marcy will talk about it, but a pretty unusual kind of corporate commitment to social value and so on, and that undoubtedly provides some additional benefits and maybe some challenges too. And then we'll move on to some of the other components of goal setting and measurement.
Okay, great. It's a pleasure to be here. For PepsiCo, I guess it dates back to 2007. Our CEO, Indra Nooyi, sort of set out this business strategy, which we call performance with purpose, which is underpinned by our belief that PepsiCo's success is inextricably linked to the success of society. And we sort of operationalize performance with purpose through 3 pillars. One focuses on human sustainability, another one is environmental sustainability, and then the third is talent sustainability. And all of our business practices, as well as our community efforts, sort of focus along those three pillars. From a foundation perspective or a citizenship perspective, the way we align our efforts with the efforts of our business is through performance with purpose. And so as we seek to sort of narrow and focus where PepsiCo is going to invest their philanthropic dollars and invest their resources to service the community, we focus on 6 what we call strategic imperatives. One is around affordable nutrition, another is around encouraging healthy lifestyles, providing access to safe water, advancing sustainable agricultural practices, enabling job readiness, and empowering women and girls. And by doing those things, we're actually able to better leverage our expertise to solve the problem. So it's about having the ability to bring more than just our money when we go after tackling issues. For today's discussion, I'm going to focus primarily on our water portfolio because that's where we are the most advanced and mature in terms of measurement. Water is very important to PepsiCo as a food and beverage company that operates in over 200 countries around the world. Obviously, water is a critical resource. A lot of people don't think of us this way, but at our core, we're an agricultural company. So I think 13 of our 20 raw materials are actually from agriculture, and agriculture represents 70% of global water use. So in order for our company to be successful, as well as the world to be successful, water is a very critical element. And we think about water both in terms of our operations as well as the community. And when we talk about water in the context of the community, it's not just philanthropy for the sake of philanthropy. I mean, at the end of the day, our business's success, whether you're PepsiCo or Merck or anywhere else, is a function of how successful those communities themselves are. And water is sort of a foundational element to help ensure that the communities can thrive well into the future, and as a result, our company can thrive. And so when we think about water, we sort of set two primary objectives. One was really a business-focused effort, which was really around improving water use efficiency in our operations by 20%. And then similarly, we set a goal around delivering access to safe water. And the original goal was set to deliver access to safe water to 3 million people by 2015. So getting to Farron's earlier comment, in both cases, we were pretty explicit about our objective. I think the challenge, which we'll talk about as we go through, was that we set this bold public goal, and then everybody kind of looked at each other and said, well, now what do we do? Because ultimately, we were going to have to be able to report against how we were doing. I don't know if Farron.
So that's great. So the bold public goal, can you talk a little bit about where it came from? Who were the drivers and who are the key stakeholders to help identify this as an issue, and then ultimately to set that specific goal?
Yeah, so I think that the goal originated our work with our water partners. So we have 6 core partners, and our work with those partners actually, with some of them anyway, predated the goal. So we had, water stewardship has been an important part of what we at PepsiCo do. And so we had started working early on with Safe Water Network, with Columbia Water Center, to deliver programs that would help address the issue. I think our public goals specific to access to safe water was part of a broader public commitment that PepsiCo made related to performance with purpose, which we call the promise of PepsiCo. And at that point in time, we had established a number of metric-oriented goals around things that we were going to do as a business. So water access was one of them, but we had commitments around reducing the level of saturated fat in our product portfolio, increasing the diversity of our workforce. So we had a number of specific things, and water was a piece of that. I think at the time, and this doesn't predate my involvement at PepsiCo, but predates my involvement with the portfolio, they looked at the partners we were working with, and it was a very clear strategy. So we recognize, as many people do, there's not a single solution to the water crisis. And so our partners actually are all working to address water stewardship in a different way. Some of them focus on conservation, others focus on distribution, others focus on purification. And the interventions are very different, and as a result, the impact and the number of people you're going to be able to positively affect or provide access to safe water to is going to vary significantly depending on the intervention. And so I think the 3 million number was set. I think at the end of the day, folks felt it was bold enough. Obviously, it doesn't solve the water crisis, but it was a bold enough statement, and we felt that we had enough tools and partners available to start to work towards that. But it's not as if, as I mentioned, we didn't even know how we were going to measure it at the time. So it's not as if there was some quantifiable mathematical thing that we sort of set back and said. And then I do think, and again, it was before my time, there were discussions with external stakeholders as well as our partners on sort of the reasonableness of the number.
So it's kind of batting around at some ideas, seeing what seemed bold, and then throwing it up kind of against the wall and seeing what sticks. Like, do people agree? Like, does this seem bold and achievable?
Yeah, and I think, from Pepsi, we're a very performance-based organization. So we wanted to put out a number there that we felt we could garner the resources to actually get at. And that was bold enough to make a statement, but a number that was achievable, to your point, or we felt we could achieve.
Okay. And then how about in that process? So as you've worked internally with your goals and the data collection, and now you've expanded your goal from the original one, you've expanded it. How has the conversation evolved internally as you get to know what you can achieve and what you have achieved to kind of make people say, oh, this is worth doing, and we're going to expand not only our goal, but maybe do more things and broaden your vision for this?
Yeah, so I think, the partners that we work with are key. So they're key both to our ability to deliver against the commitments that we made, as well as key to working with us to determine how to measure it. And so, as I mentioned, the original goal was to deliver access to 3 million by 2015. We actually hit that goal at the end of 2012, and then in early 2013, we committed to doubling it. And so now the goal, as you mentioned, is to deliver access to 6 million by 2015. And the way that we were able to both establish a measurement methodology and continue to be confident in our ability to sort of deliver against that commitment is directly tied to the partners that we work with, their expertise in the space, and sort of leveraging knowledge that's available not just internally, but externally. So, obviously you and your organization have played a critical part in how we think about measurement. And so we've gained over time, I think, a degree of confidence, both in our ability to measure, as well as our confidence in the actual result. Because I'm relatively new to this work. I've been involved in this part of PepsiCo since early 2012. And my immediate reaction when I sort of inherited some of this was like, well, how do you know that there's actually someone in India that borrowed that money and has now has water that didn't have before? And our partners really work very hard to sort of do the level of validation and stuff so that we can be confident in the work that's being done.
Okay, great. One other note, I think what I'm impressed by is PepsiCo's openness to sharing the structure and the measurement structure and promoting that through the sector broadly. There's a lot in the corporate world of doing an investment and trying to own it and kind of brand it and say, oh, look, that's how we're gonna extract business value out of it. And then what PepsiCo has done is focused on a lot of the models and work and measurement, and then presenting it and pushing it out into the broader water sector, which I think is incredible from a leverage perspective in terms of increasing social value by getting more people to organize around a common approaches and so on. To what degree is that viewed as, a risk internally?
Yeah, I think that our approach to water from a community perspective has been just that. It's been very open and very public, and we seek, not just in our water program, but generally speaking, as many companies do, to identify and pilot innovative things that can help solve critical issues, with the hopes that when those solutions prove to be successful, others will invest to sort of help the scale. And so I think that we work hard to make sure that we're sharing. And part of, I think, what stringent goal setting and measurement does is it allows you to identify both the successes as well as the failures. And actually, Farron taught me this, so I'll quote you. But you can learn more from the failures than you can from the successes. And so by having measurement in place, it actually lets you know not just what you're doing well, but what you're not doing well, so that you can course correct. And so we've been fortunate to work with a group of partners who really value that as well. And so we actively partner with them as we sort of go through our data gathering process to evaluate where are we being successful, where do we have opportunity, and sort of what's the next step. And I think it was always an underpinning of our work that the intent would be to develop this framework. Quite frankly, when the work began, we sort of assumed there was a framework out there, and then came to find out there was no way across the water sector to actually do this measurement in a consistent manner. And so we worked with our water partners and with True Impact to build a framework and then a methodology that we are sharing with others in the sector for hopes that they would we can learn from them. So, very often they're telling us what they think makes sense as well as what they don't think makes sense. And then we're also looking at how we can now leverage this framework to measure across the other areas where we do work. So as I mentioned, water is a key component of the work that we do, but we've got a set of partners that we're working with in the area of affordable nutrition, as well as in the area of encouraging healthy lifestyles. And so our next sort of evolution is to figure out how we can take the framework and then apply it to some of these other areas.
Okay. Great. Brian, maybe we can jump into your portfolio and talk, introduce Merck and some of the great work that you do. And please also touch on the fact, I think Brian came from the HR function, which is one of the, as we all know, one of the big promise areas for generating business value from community engagement. And I think that perspective is really valuable for your position where you are now.
So for those of you that are not familiar with Merck is a healthcare company. If you were to pigeonhole us within the healthcare space, we're a pharmaceutical company, but we also have an animal health business. And for a few more months, we'll have a consumer health business as well. We just sold that a couple weeks ago. The company has a really inspiring and kind of noble mission. And when you boil it down to it, we exist to save and improve lives. And when you think about one of the core pillars of the company's corporate and social responsibility endeavors, it really is focused on increasing access to quality healthcare. And so while Farron asked an interesting question earlier with a show of hands, how many companies have signature initiatives, how many have kind of broad portfolios, we have all, right? We have both. And the portfolios that we have fall into these categories of health, so increasing access to quality care, improving the health and well-being of people throughout the world. We have an education portfolio that focuses on STEM education, and we have community-based programs where Merck has a significant presence in their communities. And then adjacent to that really is our employee engagement and volunteering efforts. Measurement for Merck, I think, in the work that we do from a CSR standpoint has been a really important component to it for years, long before I joined the group, which was about 2 years ago. And we have different degrees of sophistication in how we approach measurement at Merck. If I were to look at programs in our health portfolio, it's where you'll probably see the most robust measurement frameworks and approaches. If I look in our education and community portfolios, I think there's a lot of room for us to grow. Measurement is important to us because we kind of ascribe to this model and this philosophy of the work that we do, that there ought to be a beginning, a middle, and an end to the programs that we are funding. We don't see kind of as a sustainable solution kind of Merck or the Merck Foundation indefinitely funding things for, in perpetuity. And so measurement plays a really important role. So when I think about some of our health programs, and I'll talk a little bit about one of our diabetes programs, measurement helps us understand what's working and what's not working, to the point you made. And when we think about kind of the long-term sustainability of one of our health programs, being able to have a story to tell, what's worked, what's not worked. When we embark on an endeavor, we have this hypothesis of what's an innovative way to meet an unmet need. And so we invest money and time, and in some cases the time and talent of our employees as well. And we'll spend 3 to 5, 10 years working on a program. The long-term solution, the long-term sustainability of that program is really going to be contingent upon our ability to tell an effective story about whether or not that intervention has worked. And so we build money, about 10% of each one of our grants in our health portfolio, and we're moving to do this now in our education and community spaces as well. We allocate funding for measurement and evaluation. And what it allows us to do is it allows us to tell that story to stakeholders, whether they're partners or they're governments or public health departments in some cases, insurers in some cases. It helps us tell that story and ideally helps us be able to demonstrate that the intervention was successful. And then it brings about a response from other players in that sector to actually help sustain that solution over time. So without a really robust measurement framework, from our perspective, it's really hard to have a really meaningful end game and a transition and sustainability plan.
That's great. Do you want to talk a little bit about a particular program or programs where you started out with maybe a grant idea in mind
Yep.
and say, okay, here's a problem we want to solve.
Yep.
Now let's step back and say, gee, how can we leverage as much as we can? How can
Yep.
we generate as much value for the company as
Sure.
possible?
So, and I'll pull from one of our major health programs, a diabetes program. And this was a theme that's been throughout the summit over the past 2 days, we very much try to align the work that we do out of the foundation, which I lead. We try to align that with areas of interest to the company. So diabetes is an important area for our company, and so we invest in diabetes programs. What we'll often do, the approach that we'll often take in one of our major multi-year, multi-million-dollar programs, is we will work with advisory groups, sometimes consultant groups, to try to really understand an access to care issue, right? So why is it that there are certain pockets in the population in underserved communities that even with programs, the US government programs like Medicare and Medicaid, people are still not availing themselves of care for a condition like diabetes? And what we'll do is we'll try to understand where in the country, in this case this program here is in 5 cities across the United States, we'll try to understand, what are some of the challenges and what are some of the innovative solutions that are out there that people may be experimenting with. And then in this case, what we did is we actually sent out an RFP. And so we got over 100 RFPs from city departments of public health, federally qualified health centers and so forth, who came and said, we would love to take advantage of a partnership with Merck to try out an innovative solution to really increasing people's access to quality care in the diabetes space. And so that's how the program, the diabetes program, it's called the Alliance to Reduce Disparities in Diabetes, it's how it came about. And we bring in stakeholders. So in this case, addressing an issue like this is multifaceted in nature. There's lots of different components to trying to solve a puzzle like that. But we bring in stakeholders that help inform really what the goals and objectives of that program ought to be. So stakeholders in a program like this would include patients. It would include healthcare providers, both physicians as well as community health workers. You might bring in this case, we did bring in kind of a health system, so the public health system in those cities that we were working. And together we collaboratively put together kind of a series of goals and strategies and tactics to try to implement that. And up front, we identify what the metrics ought to be. So for example, from a patient standpoint, we're looking at glucose levels, sugar levels in people's blood. If we're trying to increase access to care, the ultimate goal ultimately is to help people with diabetes who otherwise don't have access to care to get their diabetes under control. So from a patient perspective, we're focused on the actual condition that they're suffering from. I think what we're also doing from a patient perspective is we are trying to empower them, so educate them more about their disease and equipping them with information and language and frameworks and tools to help them actually engage in meaningful conversations with their healthcare providers. So they are actually an active participant in their own care. For many of these people, that's not been the case historically. From a provider standpoint, so from a healthcare professional standpoint, we're also providing them with education, often in the form of continuing educational credits or courses, where they are learning how to deal with populations in these underserved communities and understanding what some of the cultural barriers might be, helping them understand how they can help people understand what they're actually telling them around the importance of monitoring their sugar levels in their blood. And so, I can go on, but we have other stakeholders like the healthcare systems themselves. We have community players. So in some cases, the intervention also involves partnering with local grocery stores where you're helping people with diabetes learn how to shop more effectively for healthy food and how to prepare that. So, we bring all the stakeholders together and then we identify up front, to your point as well earlier, Farron, beginning with the end in mind. So what is it that we're shooting for? And the metrics that we'll put in place are a combination of both outcomes, so in the case of a person suffering from diabetes, is it under control? And then there are output measures, so the number of people who have attended some of these training classes, the number of people who would measure things like their confidence levels in trying to actually engage with their physician in a conversation about their care.
How about maybe a last question about this, and then we'll take quick questions of them about this before we go into kind of the roundtable. How about so that's from a social impact perspective, that's great. I mean, you're really vetting the theory of change and thinking about what does it take to move the needle on the thing that we care about, which is wonderful. And then looking, the outcomes being kind of the investor metric, what are we buying in terms of social change? And some of those outputs or processes can be more like managerial and operational. What can we do to kind of make sure that things are working well or improve them and so on. But then how about from the business perspective? When you look at these and say, all right, this is a social impact, this is the thing we really care about, but gee, as Merck, we're a company and we have a bunch of other business interests. What are the key stakeholders that you commonly work with or things you're thinking about?
Right. So for a program like our diabetes program, I think the stakeholders there, are the things that matter for the company from the business's perspective, are things around reputation, license to operate. When we are working with, from a commercial standpoint, we're working and we're trying to sell our medicines and get our medicines on formularies. Oftentimes payers, insurers care an awful lot about, are you in it just for the profit, or are you also interested in actually giving back to the communities and where you have a presence and really addressing unmet needs that patients have who don't have access to the care. So when we look at it from a license to operate standpoint, we look at it from a reputation standpoint. In one of our other programs that we have that really falls more in the employee engagement space, we have an international corporate volunteering program. And when I think about, from a business standpoint, what is really important to Merck, having its employees go and spend 3 months fully embedded in a nonprofit, what we talk to our executives about, members of our executive team, our HR colleagues, what they're really interested in is the developmental experience that the employees are having. So we have measurement frameworks that we're working to put in place, really trying to gauge the impact that a 3-month experience in an emerging market, what that has on the employee. We're also looking at trying to leverage the learnings and insights. So I think as part of the conversation yesterday, one of the I think the full plenary sessions, there was a discussion about doing work where you don't yet have a commercial presence. Well, that's where many of our employees who are serving as fellows are going. They're going into markets where Merck does not have a commercial interest. And so the insights and lessons that they're learning around what those healthcare issues are, the roles of both the public and private sector in trying to address those concerns, is really instrumental to our business as we think about either growing our presence in markets where we have a very limited presence, or we're thinking about entering in markets where we don't yet have a presence. So those learnings and insights are very valuable.
Okay. Great. So why don't we move it to a few questions about what we've talked about here, and then we can move into the table session.
I was hoping you could share any insights on setting metrics for employee engagement and volunteerism specifically.
We don't do very much of it today. So from a PepsiCo perspective, I'm going to defer to Brian, hoping that Merck can give you more insights. We look a lot, at this point in time, we're primarily tracking sort of hours and just trying to gauge how much volunteering is out there. And quite candidly, we don't even have the systems and infrastructure in place to do that consistently globally. So when we report our numbers to CECP, we know the number that we actually do is far in excess of that, but we don't really have the mechanisms in place. Although we are in the process of working with a new vendor to implement a platform that will allow us to hopefully measure that more consistently around the world.
Yeah, I mean, ditto for us. We don't have explicit goals for the percentage of employees or number of employees that we're looking to have engaged in volunteering activities. We do things like tracking their hours. We provide incentives in the forms of Dollars for Doers grants, which I'm sure many of you do as well. The place that we're really leaning more into measurement and evaluation from an employee engagement standpoint is more in our skills-based volunteering. I referenced the fellowship program that we have. We are trying to measure the impact that those fellows are having in the nonprofit organizations that they're working the primary goal of that program is really to enhance the capability and capacity of the organizations that are hosting our fellows, to help them be better at doing what they do. But we're also looking at, so what is Merck getting from the experience? So we're investing 3 months of salary and benefits. We provide our fellows with executive coaches, and we kind of want to understand what our ROI is for that. And so we've been working very strongly with the HR organization to kind of track these people over time. When are they staying with the company? If they're staying, how are they moving and progressing? How are they being treated from a performance evaluation and long-term incentive standpoint? Some markers that help us glean whether or not their experience is helping them advance in their careers and also at the same point contributing back to the company. So our focus is on measurement and evaluation is much more on the skills-based part of what we're doing than it is on what I would consider more traditional volunteering.
One note about that, you measure skills-based volunteerism in the same exact way you can measure traditional volunteerism. It's just the impacts of traditional volunteerism tend to be a smaller magnitude. So if you're thinking about what's the impact on the nonprofit, are you helping improve capacity, say the efficiency, the effectiveness, or reach, that's on one side. But then on the business side, if you're thinking about engagement or job-related skill development or people developing new relationships that can drive sales or recruiting or other stakeholder interests, those are kind of the typical categories. And you see more of that in ICV programs where you're making a huge investment, but you can take that same kind of structure to your traditional volunteerism.
Can I add something? Yeah, the other comment I would make is we have a skills-based volunteering program as well, and where we've also leveraged it is with the partners that the foundation is supporting. So, where there are potentially gaps or opportunities to further enhance their capabilities, so we've used it in that regard. So they're not typically working on the programs that we're supporting, but they may be doing work with that partner somewhere around the world. In addition, we've also started to use it with organizations that we're not yet working with, but are thinking we might want to work with. And so there's an opportunity to sort of get all the benefits of a skills-based volunteering program while also gleaning some benefits that the foundation can use as we're making investment decisions.
Hey, Stacy Chasson with the Dow Chemical Company. You talked about when you set your goals, thinking about what's important to your company and your business, but do you survey or poll your communities where you are to see what's important to them and where they think your rightful role is? And if you do, how do you measure that effectiveness once they say? That's interesting.
So I can try to answer it first. So if we think about the work that we do in communities where our company has a significant presence, we have what we refer to as a neighbor of choice program. And going out and listening to what the needs are of the community is really an important step in that process. That is the one part of our giving portfolio where we actually will take in unsolicited grant requests. And so we are hearing through the grant proposals, through our conversations with members of that community, kind of what the needs are of that community, and then the decision makers, we have site-based kind of committees that make these local-based decisions. They are in essence listening to the input from the community around where the greatest need is, and how is it that we as a company can support that. I think one of the things that we've begun recently to do in our education portfolio, our focus is on STEM education, and we're shifting our focus away from K through 12 into more graduate, postgraduate science. We've had long-standing relationships with school districts where our company has a presence here in the United States. And to your point, what I've been doing over the past 3-4 months is actually spending time with those school district superintendents and listening to what their needs are. So if we're not going to be funding the program that we've been funding for, frankly, the last 20 years, how is it that as our priorities shift, we can still maintain some relationship with the school districts? And so what we ultimately choose to do to maintain some level of support and interaction with our local school districts is going to be completely contingent upon the input that we're getting from them through live conversations. So listening to that community voice is absolutely important for us to demonstrate our commitment to supporting those communities in a way that not only makes sense for us, but frankly makes sense from their perspective, because that's whose needs we're trying to serve. Did you want to?
Yeah, I guess I think our perspective is somewhat similar. Generally speaking, we don't take unsolicited requests, and so the vast majority of our funding, while we have regional programs similar to what Brian described, is driven by causes and programs that we think are important, and more often than not, we think it's important because we think we can bring something more than just our money to go solve it. However, what we'll do is we've also identified sort of key priority regions and geographies, which are really those places where around the world we've deemed to be most important from our business perspective. And what we look to do is align that with the need. So we're not going to go do a program. We will look to do a program in the place where the need is greatest, as long as those needs align with sort of the geographies that are important to us and the programs that are important to us. And those geographies, as Brian mentioned earlier, may be important to us because we've got a huge presence, and therefore there's expectations on the part of those communities that PepsiCo is going to be doing things. It could also be based on places where we would like to have more of a presence, and we're getting in there earlier for license to operate reasons. Quite frankly, it's much more challenging to implement programs in those places because we don't have resources to leverage.
Let's do one more quick one.
This is a related question, and you started to answer it. Do you take into account maintenance of license to operate in measuring the impact of your activities?
Yeah, I think it's an interesting question. If anyone has any suggestions on how one might measure it, I think it would be great. We talk about it a lot. And we certainly know when it's sort of, in my opinion, you know when it's not there because you're not getting what you need to actually, to advance your business interests. I think it's difficult to know when it is and how and the degree to which it is. So in response to that, we're not, but I would be interested to do it if we could.
Yeah, I wouldn't say that we have any hard and fast specific metrics around it, but anecdotally, I would tell you that it makes a huge difference. So, we work in an industry that is constantly changing. There's consolidation going on. There's downsizing that's going on in our industry. And so as we have closed manufacturing facilities or we have opened manufacturing facilities in new areas, the relationship we have with that community around rerouting roads, building new buildings, or when you're dealing with some of our European sites where you've got works council issues and we're closing a site, the fact that we have been a kind of a reputable partner in that community, investor, not just from a business standpoint, from a community well-being standpoint, has helped us tremendously as we've gone through some really challenging situations, and also in other parts of the world where we're looking to increase our presence. The fact that we have been a good community neighbor and a good corporate citizen in the communities where we operate has absolutely made a difference in those local governments being willing to help us expand, reroute roads, things of that nature. So no hard and fast metrics, but where we have invested in those communities, those transitions, whether they're on the positive side or negative side, have gone a lot smoother where we've invested that time and energy.
That's a very good question. The one way to think about it is often in terms of risk. If we were to effectively lose the license to operate, if we got our key stakeholders angry at us, what would then happen and what would that cost us, either in terms of regulation or legislation or prevention of achieving some other business goal? So you could even monetize the magnitude of that. We've seen that a couple times, but then you get into a little more, all right, here's the value of this thing that could occur. Now let's see if we can change the probability of that happening. So this is a little bit wonky, but that's a way to kind of present it and think about it. And you don't have to calculate expected value or probabilities or so on. You could just say, here's this bad thing that could happen, and this is something you're typically doing maybe with government affairs and saying, oh, did we materially reduce the probability of this bad thing happening? Or are we in a position now that we could be in a stronger position to proactively address some kind of thing? Can be an effective way to think about it. All right, so let's, we're running short on time, so why don't we jump over to this little guidance. Take 5 to 7 minutes to kind of meet your neighbors and talk about maybe 2 different things. Just think about what are things that maybe you've learned over the past couple years. Maybe try to think of the one thing that maybe you could have told yourself, if you could, kind of go back in time and tell yourself, hey, this is a great little insight as it relates to measurement. I wish I knew X. Try to think about that and share that with your neighbors. And then as a table, identify maybe the top 1 or 2 things that you discovered as kind of ahas, and we'll kind of report that out. And while you're doing that, if you have any kind of other questions that you want to kick out to the panel, you can record that as well. So go to it.